Developmental TIPS is a state program in Nebraska which follows essentially all graduates from newborn intensive care units. Because of funding from the state and support from the individual hospitals, this program is at no cost to the family. As I look at it, there's two major purposes for developmental TIPS. The first is the benefit for the child. Unlike a primary care physician, we have the luxury of having a multidisciplinary team available to look and evaluate the kids over periods of time that the primary care physician would drool over, to be able to look for both major and minor deficits. Some of those major things that we worry about in the first couple of years of life are things like cerebral palsy, intellectual disability. We look for things like autism. Some of the more minor things that we can pick up a little bit later on will be things like speech and language deficits, some early behavioral issues, and even the early cropping up of things that are predictors of specific learning disorders. So we really want to act with the primary care physician and help find those kids who are at significant risk and are showing some signs of some early sequelae. It in no way should be looked at as something that supplants the role of the primary care physician. It is truly a developmental screening program where we follow graduates from the NICUs longitudinally over the first 2 to 3 years of life.
As a primary care physician, this is important and helps me to serve my patients better, because they help me track those patients and they help me keep them on track and reaching their full potential behaviorally and developmentally.
We really want to help the parents and the primary care physicians get those kids involved in early intervention. The data on early intervention is really pretty clear that early intervention does help ameliorate some of these more minor disabilities. That's why we're doing it for the individual kids and the individual family. The other thing that as providers I'd like us to remember is that there's a long history in neonatal intensive care of a lot of things that we've attempted that have worked out well and things that we've attempted that haven't worked out so well. The way that we can quality control a lot of the interventions within the newborn intensive care units is ultimately by looking at the final product. And the final product is the kids that leave the nursery and how they do when they're in kindergarten, when they're in first grade, as they get to be adolescents. And so it's vitally important, I believe, for both the sake of the child and for the sake of neonatology, to follow kids who graduate from the newborn intensive care units closely in a very standardized way, so that we can get the information to both help the kids and help the neonatologists of the future.